So we're looking at part 18 in our hydrotherapy theory and practice. And we'll continue on with some of the practical applications. But before that, just want to remind you that as you navigate any health challenge, just want to partner with someone who has a similar idea of healthcare that you do and disease and health. And that the things that we talk about here are just other tools for your toolbox of health to maintain and or regain health if necessary. And any protocol, treatment, or procedure, you need to not blindly accept it, but check it out for yourself completely before using it. Thomas Edison made a forward-thinking statement back in 1903, which talked about the fact that doctors wouldn't be prescribing medicine, but would be teaching their patients how to take care of themselves and what to eat and how to prevent disease. But even before that, in 1885, we have a statement that's even predating that. There's only one way that heaven approves for practicing the healing art, and that's using the agencies of nature: pure air and water, cleanliness, a proper diet, and purity of life, and a firm trust in God. These are the remedies for which thousands are dying. They take time to implement, but they are not expensive either in outlay of funds or in taxation on the body. So I talked about firm trust in God, and that's the anchor point of 3 John 1 and 2, that, beloved, I pray that you prosper in all things and be in health just as your soul prospers. So we do have to pay attention to the physical aspects and the things we put into our bodies and how we take care of ourselves and the things we subject ourselves to, but we also need to have a constant connection with God. So part of sanctification is habitual communion with God. Romans 12:1 and 2 says, I beseech you, therefore, brethren, by the mercies of God, that you present your bodies a living sacrifice. So remember that living sacrifices are wholly acceptable, without blemish, to the best of our ability. Do not be conformed to this world, but be transformed by the renewing of your mind, that you may prove what is that acceptable and perfect will of God. So we really do have to take care of our soul. We have to take care of our minds and submit our will and minds to God so that he can bring them into his perfect will. And back in the Ministry of Healing, sometime around that same time, just an admonition to make sure that we know how to take care of ourselves, that we're fearfully and wonderfully made. That is from Psalms, and that he wants us to take and make our study how to preserve and take care of our bodies and keep them from being desecrated and harmed. So tonight we're going to be continuing on the general topic area of local hot application. So this is a continuation of that, and it's just a specific hot hydrotherapy application for a target area. So target area can be large or small. Typically in this type of a situation, it's small. We're going to be looking at one target area to start with here, and that's the sinus pack. So this is actually using several different hydrotherapy modalities at the same time. And they're focused on pain relief and sinus infection reduction. So the things that you'll need for that are fomentation cloths. So those will be dipped in hot water and wrung out, used as a hot fomentation. 2 trays of ice cubes. So we're going to be using those ice cubes. 2 small dry towels, a hot foot bath basin for the feet, as you can see in the picture, and then things for a hot spinal fomentation, which we've covered previously. So that's basically an application of fomentation to the spinal cord region of the body. So applying the sinus pack application, we have, remember, it's 3 different things that are several different things that are simultaneously conducted or in rapid succession. So one helpful thing is to have the bed or the area where they're lying right up against a wall, and that wall will provide an area of support for helping to keep some of the packs in place, the parts of this pack in place. So lie the person on their back with their feet in a hot foot bath. So their legs are going to be slightly bent. So you want to make sure you cover the bed with a sheet or some other plastic material in case there's water spillage. But they'll be lying on their back with their feet in a hot foot bath. It has a warming effect for the entire body. It also draws circulation from the head to the feet. And this is, rather than having a sitting position, hot foot bath, this is a lying or a prone position. So you're going to be using 3 sets of hot fomentations to the chest. So that's what the fomentation process is. You'll do 3 minutes of hot fomentations to the chest area. So remember, this is a sinus pack, but we're starting with a hot fomentation to the chest with 30 seconds of cold. You're going to do that 3 times without any delay in time in between, just a rapid change out. Make sure you use a full 30 seconds for the cold. But the third fomentation, that's the hot aspect of it, you're going to be leaving it. You're not going to do that third cold quench. So that'll remain in place for the rest of the treatment of the sinus pack. So you start off with a hot foot bath, having them covered up to their waist, and then do the hot fomentations for 3 cycles, hot, cold, hot, cold, hot. You're going to have that hot be maintained, and it'll cool over the course of the treatment. Then you're going to make 2 ice packs. So you're going to use 1 ice tray of ice per pack. So take a small dry towel and fold it to about 5 by 10 inches in size over the ice. So basically you're making an ice packet. And this is in a dry towel. You're going to position one of those under the back of the neck. So right up to the base of the lower edge of the skull. And then just moisten the top of the head and place the other second pack on top of the head. And this is where the wall comes in. The pillow and the wall will help to support that pack in position against the top of the head. So you've got a cooling hot fomentation on the chest. You have a cooling aspect with ice on the back of the neck, the top of the head. And then you're going to take a small dry towel, like this individual here that you see laying on the bed. So take a dry towel, and you're going to hold the center down where the upper arrow comes down to a point there. Just put a finger there and then draw the other corner down over so it covers the eyes. So it's going to make kind of an arrow shape. And when you pull both corners down, they're going to cover the eyes and allow the nose to poke through the slit. That's how it should look. And basically that's a protective, that dry towel is a protective of the eyes for the application of the sinus fomentation. So this is a dry towel that is a protective layer. So you're drawing those corners down towards the upper lip on both sides, keeping the point up on the forehead and having the nose peeking through the slit. Then following that up with a hot fomentation. So a single hot fomentation, and it's going to be a towel the same size. You'll apply it initially the same way and then draw it down so that it mimics the dry towel below. So the nose will be poking through the slot. You want to leave it in place for precisely 3 minutes. So you want to have a clock handy, second hand, so you can time it for 3 minutes. And then once you've reached the duration of 3 minutes, remove the fomentation towel, and then wring a new towel from ice water and apply that to the reddened area that warmed up with the increased circulation of the hot pack. And then leave that on for 30 seconds. So then finish with a quick drying of the face and do a second application of the hot pack over that dry pack. So 3 times. So like all fomentations, like all the treatments, you're going to do 3 cycles. Like a contrast shower, it's 3 cycles of hot, cold, hot, cold, hot, cold. And then once you've completed that third rotation, there's 2 different ways you can finish up the treatment. You can either do a cold mitten friction, so that's using a mitten or a cloth on the hands that the friction helps to actually synergize with the circulatory and stimulate circulation, starting with the face where you've had the application of the fomentation, and then working down to the feet that are in the hot water bath, so working down the body completely. Or if they're able to, do a contrast shower, so do hot, cold, hot, cold, hot, cold, to finish off the treatment. So it depends on how ambulatory your individual is that you're working with, how well they can walk, how well they can get up. If they're not very well able to withstand the physical application of a cold shower, then the cold mitten friction is a better way. So it's nice to have an alternative way to wrap that up and still have a circulatory stimulation effect that is systemic wide. The next thing we'll look at in the realm of hydrotherapy is a small section here on poultices, and it is included here because it's using some hot water to be a component of the poultices. And there's different types of poultices that can be used. They have different therapeutic modalities. We won't go into the entire potential of these poultices, but we'll talk about them in their generalities as far as just a general poultice application, as well as some specific ones to be familiar with. So they're very, very helpful to add a salve or put a salve onto a particular area made up of the herb or constituent that you're using as your poultice. You want to spread it on a damp cloth, and then you're going to put that onto the affected area, and then that helps with infections, inflammation. It's generally directly, the infection or inflammation is directly just below the surface of the skin. Sometimes you can do poultices for deeper types of situations. In fact, there was an individual that we were aware of that had a kidney infection, went into kidney failure, and ultimately died. And during the process, one of the thoughts that went through my head is this person needs a kidney level charcoal poultice in a big way to help draw that fluid off and help to pull the poisons off. And whether or not that would have saved his life, I don't know. But I think it probably could have done a lot to have pulled out whatever was making him extremely ill at that time. There can be multiple factors in play, of course. So some general benefits of the poultices: it reduces inflammation. So the one you see here is a mustard poultice that can help with that. Pain or congestion relief. So congestion isn't always just sinus; it can be circulatory congestion too. And again, we've talked about how a contrast hydrotherapy treatment acts like a second heart in a way, in that it opens and closes and draws blood and pushes it away like a heart would through the rest of the body. Absorbs poisons, it can neutralize toxins, bites, and stings, kind of similar but different. Can help with abscess and boils, bringing them to a head so that they can go through their cycle more quickly. And just like someone who's healthy and treats a cold aggressively or an infection or a flu, they may have all the symptoms, but they'll cycle through it a lot quicker than someone who doesn't do anything, just does standard things or nothing. They can just drag on and on and on. Number 6 is it helps to reduce swelling, and it can deodorize various wounds and things like that. Number 5 or 8 is a treat wounds, and it deodorizes it because most of the scent is coming from putrefaction of tissue that is dying or rotting from bacterial challenge, which could be just simply because of the wound and then an infection, and it's basically the bacteria trying to clean things up. And it's a natural process, but it can cause systemic issues if not dealt with. So poultices can help with that as well. And then can be antiseptic or disinfectant depending on what you're using for your various poultices. We'll look at some of those poultices here. So your supplies for a poultice, you're going to need warm water and a bowl. So you can see they have a mixing bowl here for that, a spoon, and some muslin or flannel, some wool cloth. That's going to be your covering over the outside. A piece of plastic is going to be between the outside layer and the poultice layer, just to help keep it from being messy and also retain the poultice and the heat to some degree. And then some way to secure it into place, either a pin or some tape, and then ice and a wet cloth as far as, and that's used primarily in the final, once you've left it on for a period of time, often it's overnight, just wipe it clean with a white cloth and ice, and that is a circulation inducer. So let's look at some of the different types of poultice ingredients. You can use glycerin and clay. You can use comfrey and smartweed, hops, mustard, garlic, charcoal. There's onion, and there's a whole variety of others, a smorgasbord of others, so to speak, that you can use. But we'll just go into a few here that have been indicated. So the general application procedure: prepare in a warm room, and then we'll have the recipes coming up here shortly. Place the poultice or salve on a damp cloth, and then apply to the area that needs to be treated. So in this diagram here, there's an arm there with a wound of some nature, a boil or a cyst or something, and then apply it to the treatment area and cover with plastic. So you may put the poultice directly against the skin. Depending on the poultice, you may want to have a layer of cloth between the poultice itself and the skin. It just helps to hold it in place. Sometimes, like charcoal, for example, if it's left on too long, can do some tattooing. So having it in a packet that's moist and can be directly associated with the skin area can still allow it to be do its work. So the plastic is there to help retain the poultice in place, and then the wool outer covering will just help maintain the heat and help the whole area to increase in circulation. then pin or tape it in place and leave it on overnight. That's the best time because you're not active and going to be losing it or having it slough off during the activities of the day. Depending on the poultice, you may want to have some kind of a covering on the sleeping area just to prevent messy poultices. Understand that potato poultices make really great poultices, but those are best done during the day because they are notoriously messy and difficult overnight. So removal, you just want to make sure that you don't spill everything anywhere. You want to maybe be in a sink or someplace like that if available, or have plastic on the bed if the person isn't mobile. Rub the area with ice or a wet cloth to increase the circulation, but also clean up the poultice contents. And then you can renew that poultice at that time. You can put another batch on, or depending on what you'd like to do, you could call that the end of that rotation. So let's look at some different recipes for poultices. We'll start off with the charcoal poultice. Charcoal is probably one of the most versatile things that you can use for natural healing and toxin absorption and inflammation reduction. But the reason it's so powerful is that it draws toxins into it. So this is an electron microscope cross-section of a piece of charcoal. And the thing about it is it's mostly pure carbon, and it has a very large surface area. So all those little shapes increase the surface area of the charcoal. Other things that are solids just have the exterior surface available for things to cling to. But charcoal, activated charcoal in particular, and any kind of charcoal, but activated is particularly beneficial. It has all these channels and holes and these surfaces to which toxins and substances can cling. In fact, a 2/5 inch, that's an interesting measurement, but that's what it was, absorbs 33 cubic yards, not cubic, but square yards of toxin. That's pretty incredible. So most known toxins are neutralized by charcoal. So poisons, gases, toxins, chemicals, venoms of insects or snakes. You can even do an abdominal poultice for diarrhea. So that's a deep level tissue poultice because it's going into the intestinal area. It's not just directly beneath the surface of the skin, but always have charcoal on hand. Charcoal is just an amazing gift from God. So the procedure, you need a spoon and a bowl. You can use just charcoal, but charcoal and ground flaxseed works well because the ground flaxseed, when water is added to it, creates a mucilaginous gel that helps to hold the charcoal into place. And charcoal or flaxseed on its own right can make a decent poultice and also has lots of healing omega-3s as a part of it. So add enough hot water to make a paste. And then before it cools, place it on a warm cloth. Spread it to the size that you need for the area that you're working with. So this person, it looks like it's in their forearm right near the bend of the elbow on the inside. And then you cover it with saran wrap or plastic wrap, any kind of plastic will do. And then over that, you'll then put the wool layer. So notice that it's being applied over the top of a sheet here, a wet or like a sheet of plastic, in addition to having the plastic wrap over top. Clay and glycerin. So you use a fine pebble-free clay, typically not that's found on the surface, because clay has absorptive properties a lot like charcoal does. Not quite as much surface area, but still has toxin-reducing qualities. You want to dig below the surface if you're getting it yourself from a wild source. It's always good to pay attention. We were up in Idaho this summer and found some clay veins underwater in a lake that we were at this summer, and it was really kind of neat to go down and grab that clay and bring it up and play around with it. But you want to heat sterilize it at 350 degrees Fahrenheit before using it, and then add water to moisten it. So you can use it powdered or clumped, but you want to moisten it and then add several tablespoons of glycerin. Basically, the glycerin helps to keep the clay mixture moist, so it maintains its pliability for a longer period of time. You don't want to reuse that clay. You want to discard it because it's going to be absorbing toxins, and you don't want to have that retained. So you can use just clay alone as well. So clay by itself can be used, and it will absorb toxins in the same way that the clay and glycerin will. It just needs to be maintained. The moisture needs to be maintained by misting it. So the glycerin, again, is added to help maintain the pliability and moisture of it. But you can do that with just misting it with water. So the clay alone just takes a little bit of babysitting, whereas the clay and glycerin wouldn't have that extra attention necessary. So a flaxseed poultice, you're going to use 1 tablespoon of ground flaxseed, and then mix that with a small amount of water and bring it to a boil. And then once it's boiled, then it's going to be warm. You'll let it cool down. And the yield from that 1 tablespoon is enough to cover the abdomen. So that makes a lot of flaxseed. So this diagram here shows, again, the poultice, the plastic, and the wool, and you have a cross-sectional diagram of it there too with the arm and then the side. Flax is really a beautiful flower. It has a really pretty blue flower, and it's the substance that you can make linen from for cloth. So there are ways of processing that yourself at home if you choose to grow it. That'd be a beautiful thing to have growing around. So spread the mixture on cloth and then apply it directly to the skin. And then, again, cover with plastic and secure with an ace bandage or some kind of pinning. So leave it for 30 minutes at minimum or overnight. So either way, and you can use golden flaxseed or the regular brown flaxseed. It doesn't matter. Just grind it up and use it that way. So at the end, cold friction or shower once you've taken the poultice off. That'll help increase the circulation throughout the body. So a garlic poultice. This is a powerful toxin poison neutralizer. It reduces abscesses, fungal skin infections, eczema, dermatitis, boils, acids and arthritis. This picture here shows garlic on the bottom of a baby's foot, which I think that I would put a cloth between them. You wouldn't put just raw garlic on the bottom of a baby's foot. Baby's feet are very tender, and it may cause blistering. But a cloth in between that would be the preferable way to do that, so that it's still going to draw the toxins, but it's going to just have that slight barrier there in between that tender flesh, tender skin. So the raw garlic pulp is placed on a cloth and then over the area. So it's not necessarily painless, so it's going to have like a warming effect. Again, this is a great picture, but I think it just behooves us to put an extra layer in between the baby's foot and the garlic itself. So garlic is a powerful poultice as well as a powerful antibacterial, antifungal, has many beneficial properties that we can have antiseptic properties. And it's actually most effective when it's crushed. So just as the whole garlic there, of course, sitting on the table, it's not doing anything. But when you crush it, it activates the allicin and other components of the garlic, and they become much more potent with crushing. So comfrey and smartweed. So comfrey's on the left, the smartweed's on the right. The leaves can be fresh or dried. You can blend them with a small amount of water, spread over the affected area, and then again use the cloth, the plastic wrap, and the wool wrap. You can leave it on overnight. And then you can also make a hops poultice. Just blend it up again with a little bit of water. It's great for bruises, boils, and other types of inflammation. So we typically think of hops as being used in the alcohol industry. It's a preservative. There are different types of hops that add different flavors to things, but there are some medicinal uses that hops can be used for, in addition to using them for shelf stabilization of alcohol. A mustard plaster. So 1 tablespoon of dry mustard and 4 tablespoons of wheat flour. So that's for an adult. A child's ratio would be 1 to 8, and an infant 1 to 12. So essentially what that's doing is that's diluting the mustard and making it less potent for the tender skin of the younger individuals. So you want to use lukewarm water. So here's the hydro part of it until it's nice and pasty, and then spread that on a cloth that's on a plate, just to make transport and keep it clean. So the application, apply a thin cloth to the area, and then place the poultice cloth over the area, and then plastic wrap to cover that, and the towel covers the entire plaster. So in England, Band-Aids are actually called plasters, and it's kind of a British term that I encountered one day when someone asked them if they needed a Band-Aid. Oh, I don't think I need a plaster. So that's what they referred to, the British referred to Band-Aids as plasters. So the mustard pack has a warming effect, and it can be actually enhance the warming by using a fomentation. You could also do that with a hot water bottle, but you don't want to have it on more than 20 minutes. You want to make sure that it doesn't burn or sting. Just pay attention to your patient. Don't just walk off and leave it. This isn't something you would be leaving on overnight in its full strength. So you can cover the area once you've removed the poultice. Then I wipe the area with an oily cloth, some type of vegetable oil, to help mitigate the burning. So that's true for any oil or any type of vegetative induced burning, is to dilute it with oil. We used some essential oil one time on one of our kids' necks, and it started burning, and thankfully I knew right away to cut it with oil, and that helped to just knock it back right away. Some oils require diluting, and we were just kind of new to it at that time. So cover the area with a warm blanket overnight, or a cloth. So this is going to be minus the plaster. So you've taken the plaster off, and the circulation will continue to be enhanced, and you can just enhance that circulation by keeping it covered and warm. So some cautions: mustard can cause blistering, so remove promptly if you need to. So that's where you need to have communication with your person you're working with. Best to have a communicative person. You don't want to be doing a mustard plaster on someone who can't speak to you, either being incoherent or unable to speak or communicate. I guess blinking eyes, yes for two, no for, anyway, has some way to communicate. So poultice on pus can end up causing an infection. So the mustard poultice or any types of poultice on top of pus can be not particularly beneficial. Charcoal might be the exception to that because you're drawing things into it. You want to keep the poultices warm and active, as well as the agents that are used. So a hydrotherapy-based poultice versus a cold poultice, you're benefiting from the warmth action, drawing and increasing the circulation to the area as much as the poultice itself. So deep organ poultices should cover the entire region over the organ. So if you're talking about the GI area or the stomach or the kidneys, you want to have like a total kind of lower back area for the kidneys. Just the abdominal area, you want to have the lower abdominal area completely covered. Then cover it with plastic, and then you're going to also cover that again with your blanket to help maintain the heat during the course of the treatment. So remove cold and old poultices. You want to change them out, or just you can either call it the end of your treatment or change them out and apply a new one to keep the warmth, because the warmth again is part of the beauty of the hydrotherapy based poultice routine. So there are some non-poultice uses of charcoal that we'll just touch on here. There's lots of different uses that you can use, but for stomach or gastrointestinal upsets, you can use 5 tablets of charcoal in a glass of water, and chew one of those and then drink a glass of water and repeat with each of the remaining tablets until you've consumed them all. And that water is the vector or the vehicle for carrying the charcoal to where it needs to go. So use 3/4 of a glass of water minimum each time that you're using those. So that's the stomach or GI issues. Diarrhea, 1 tablespoon is approximately 12 tablets. So there's kind of a ratio there for your 5 tablets, about half a tablespoon for 5 tablets. In a glass of hot water, and this is for the diarrhea, drink it twice a day. Or you can do that same amount in olive oil 3 times per day. So in severe cases, you may want to actually not use the charcoal, the thick charcoal, but use the supernatant. So in this bottle here, they've put a tablespoon of charcoal, shaken it up, and then let it settle. And you'll have a cloudy upper layer and then the dense charcoal lower layer. And the upper portion is the supernatant, and it's just more gentle and is more tolerable by people with severe intestinal distress. So that's just something to keep in mind if the larger slurry is not well tolerated. So if you'd like to review this or go on to look at future and past episodes, there are other episodes in sustainable gardening, homestead remedies, and looking at Earth's final warning. Just go to www.preparingforthetime of trouble.com.